Large intestine applied anatomy. Look at this picture, shows that large intestine and their parts. Radiographic anatomy of large intestine, barium enema, a detail going on. One anatomical location. The large intestine is located in the abdominal cavity extending from ileocacal junction, where the ileum of the small intestine meets the large intestine, to anus. It surrounds the small intestine and frames it. The large intestine is divided into several regions: the caesium, colon, ascending colon, transverse colon, descending colon, and sigmoid colon, as we had been seen in that picture. Then rectum and anal canal. 2. General structure. The large intestine is a tubular structure about 1.5 meters long and 6.5 centimeters in diameter. It has a broader lumen compared to the small intestine. Its well consists of 4 layers. 1. Mucosa, the innermost layer, consisting of epithelial cells, lamina propria, and muscularis mucosa. Second, submucosa, a layer of connective tissue containing blood vessels, lymphatics, and nerves. 3. Muscularis externa, composed of 2 layers of smooth muscles, an inner circular layer and an outer longitudinal layer. The outer layer forms 3 distinct bonds called tania coli. 4. Seriosa, the outmost layer, which is part of visceral peritoneum except in the rectum, which is covered by adventita. 3 associated structures. 1. Appendix, a small finger-like projection extending from the caesium. 2. Ammental appendix, small fat-filled pouches of peritoneum attached to the tania coli. 3. Mesocolon, the fold of the peritoneum that attaches part of the colon to the posterior abdominal wall. 4. Gross anatomy. 1. Caesium, the first part of large intestine, located in the right lower quadrant of the abdomen. It receives semi from the ileum through the ilioaceal valve to colon, ascending colon, ascending on the right side of the abdomen to the levels of the liver, where it is turned into the transverse colon at the hepatic flexus. Transverse colon crosses the abdomen from the right to left, turning into the descending colon at the splenic flexure. Look at this, shows that caesium, ascending colon, transverse colon, descending colon, sigmoid colon, rectum. This is appendix. Descending colon, descending on the left side of the abdomen, sigmoid colon S shaped and connects the descending colon to the rectum. 3 rectum, the final segment of large intestine located in the pelvis, it leads to the anal canal. For anal canal, the terminal part of the large intestine which open at the anus, five hematological structure, mucosa lined with simple columnar epithelium with cobalt cells and erythrocytes. Lumina propria containing lymphoid tissues providing immunodefense. Muscularis mucosa, thin layer of smooth muscle aiding in the movement of the mucosa. Submucosa rich in blood vessels and nerves supporting the mucosa. Muscularis externa, composed of an inner circular muscle layer and an outer longitudinal muscle layer with tania coli forming distinct bonds. Serosa adventita, the outmost layer covered by the peritoneum in most parts. Six, blood supply to large intestine. Arterial supply, caesium and ascending colon supplied by the iliocolic and right colic arteries. Branches of the superior mesenteric artery. Transverse colon supplied by the middle colic artery, a branch of the superior mesenteric artery. Look at this picture, shows that blood supply. A descending colon and sigmoid colon supplied by the left colic and sigmoid arteries, branches of the inferior mesenteric artery. Rectum and anal canal supplied by the superior rectal artery, a branch of the inferior mesenteric artery. Middle rectal artery from the internal iliac artery and inferior rectal artery from the internal pudendal artery. Venous drainages. Blood from the large intestine drains into the superior and inferior mesenteric veins, which ultimately drain into the portal vein. Nerve supply. Parasympathetic supply. The vagus nerve supplies the calcium. Ascending and transverse colon. The pelvic splanchnic nerves S2 S4 supply the descending colon, sigmoid colon, rectum and anal canal. Look at this picture, shows that this nerve supply to large intestine. Sympathetic supply. Superior mesenteric plexus supplies the faecium, ascending and transverse colon. This inferior mesenteric plexus supplies the descending colon and sigmoid colon. The hypogastric plexus supplies the rectum and anal canal. Lymphatic drainage. Faecium and ascending colon drain into the iliocolic and right colic lymph nodes. Transverse colon drains into the middle colic lymph nodes. Descending and sigmoid colon drain into left colic and sigmoid lymphic nodes. Rectum and anal canal drain into the superior rectal, middle rectal and inferior rectal lymph nodes, ultimately draining into the para-aortic lymph nodes. 9. Functions. Functions of large intestine. First function, absorption of water and electrolytes. The large intestine absorbs water, electrolytes and vitamins produced by intestinal bacteria, converting liquid chyme into solid phases. 2. Formation and storage of feces. The large intestine compacts undigested material, forming feces, which are stored into rectum until defecation. 3. Bacterial fermentation. The large intestine harbors a diverse microbiota that ferments indigestible carbohydrates, producing gases and short chain fatty acids. For immunofunction, the large intestine contains lymphatic tissue that contribute to the immunodefense by maintaining and responding to pathogens. 5. Vitamins production. Bacteria in the large intestine synthesize vitamin such as vitamin K and some B vitamins, which are absorbed into bloodstream. This detailed overview of large intestine covers its anatomy, structure, functions, helping to understand its role in digestive system. Thank you. Have a nice day.